prevention and live. Today we're talking about prevention and live well. We've got some great speakers from Oxford County Council, BZ, Age UK, National Energy Foundation, and also Principal of Public Health, Kate Austin. For those that don't know who Healthwatch are, we are a voice of the people. So we share patient voice experiences to our commissioners and those providers of the services. To find out more about the great work that Healthwatch is doing, look on our website, and also you might even like to join us on our the briefings that we do every month. So I'd like to pass you on to Kate Austin, who's the Public Health and Communities Principal for Oxfordshire County Council. Over to you, Kate.
Thanks very much, Jazz. I'm just going to start my slides, so hopefully everyone can see it that okay. So thanks, Jazz. It's a real pleasure to be here today. My name's Kate Austin and I'm a public health principal at Oxfordshire County Council, and a key focus of my work is around prevention and working with partners to address inequalities across Oxfordshire. So I was delighted to be invited to help shape the content of the agenda today. I've got a couple of slides to share with you just to help set the scene for today's webinar before I hand over to the other speakers. So when we think about living well and good health and well-being, we can often be drawn into thinking about our access to health services. So that might be things such as GP appointments, getting to the dentist, how long our waiting time might be for a hospital appointment, etc. And those are all really important. But as we can see from this diagram here, actually only 20% of someone's health is made up of access to healthcare, and the other 80% is related to what we call the wider determinants of health. And this can include health behaviours such as whether we smoke or not, have a healthy diet and keep active, the environment we live in, and also several socio-economic factors such as our income levels and education. Oh, my slides aren't moving. Stuck there. Try again. I think it's working now. Got a bit stuck. So just a second slide to share with you. The Health Foundation have a really helpful infographic that I'm sharing here that shows these different building blocks of health and how interlinked they are to collectively impact on our health and well-being. And you can see here this includes housing, work, money and resources, transport, the food that we eat, our surroundings, and also lots of other factors as well. So with the range of building blocks that we do need to live well, no one organisation can provide the support, the services or activities that we need to live well. So we all need to work together to build healthy communities. So I've invited along today some colleagues that are working with communities to help people to have these essential building blocks in place. So we'll be hearing first about the Live Well Oxfordshire website as a go-to place for finding all the different activities and services in Oxfordshire that can support our health and well-being. And then that will be followed by some colleagues from some of our County Council Commission services who are going to explain about the different ways that they can support people with living well. So this will include healthy weight, financial advice, better homes for better health, and also the support available to help people to cut down on their alcohol use. So I will pass over to you first of all, please, Lorraine.
Thank you, Kate. I'll just share my screen. Oh, hang on. Can you see Live Well Oxfordshire? Yeah, brilliant. Okay, thanks, Kate. I'm Lorraine Donachie. I work for Oxfordshire County Council as a Joint Senior Commission Officer, and I'm here today to talk to you about Live Well Oxfordshire. So this is the Oxfordshire County Council's online directory. It's got over 2,300 activities, clubs, groups, services, and it's for adults aged 18 plus. It's a really useful tool for people to explore their communities for support to stay independent. And that could be somebody looking for a carers group. So they've got people to share their experiences with. It could be transport to get you to an activity. It could be you and a friend looking for a local yoga class, or it could be equipment and care services to help you stay living at home. It's got lots of opportunities to support you and your loved one's well-being. So I'll just briefly show you what it can do. So you can, there's two places you can search on Live Well Oxfordshire. You can either put a keyword in this little box here, or you can go through these browsing boxes. So I'm going to start here, and I'm going to put wellbeing in because I thought that would be a good word to start. And you can see already it starts to throw up suggestions, but if I click on go, now these search results are enormous, and you know, we couldn't possibly expect you to plough through all the services that involve wellbeing. So we've got a refine your search box here, and you can put in the location. So just to pick a place, I'm going to put Banbury, and let's say you're prepared to travel 2 miles. So this cuts the search results down to a more manageable. It will happen. 371, but that's still enormous. So what we've got is these filters down the side, and this is the kind of thing that people might miss. So I'm really happy to point this out. You could search by postcode, you could search by the day of the week that you might be free, but let's stick to health and wellbeing support. So that number 74 means there are 74 services within 2 miles of Banbury. So then you've got your list of services that you can go through. If you want a bit more information, you can click on the title, gives you a bit more information, but also you can start building a list of things that you might be interested in, so you can go and have a look at them all together, and so you can add things to your shortlist or your favourites. And if I go back to the search results, we want Live Well Oxfordshire to be a one-stop shop. So we want people to be able to find services, groups, clubs, but also find out information about the thing that interests them. So under wellbeing for this, we're on the services tab at the minute. You can click on the information tab, and you have things like, it's been a little bit slow, sorry. You've got things like Educate, advice for carers, here for health, thriving with nature, assistive technology, that kind of thing. So it really is a great resource to just go and find everything in one place. So you've also got these browsers, categories that you can browse through as well. And another way to search is if you've got a certain day of the week that you're free, or you want to see what's happening next Thursday. But let's have a look at today. We've got the what's on calendar. So today there's a community meal, there's something happening at Wallingford Methodist Church, community lunch, soup, film club, and there's our event as well, dementia friendly social group. So it's another way of searching for things that help you get out into your community and use the resources that are out there. We've got a fantastic news section, and this is populated during weekdays. And it brings together things that are adult social care and health related, and things that you might be interested in, some volunteering opportunities, things that you can take part in, things that are opening, that kind of thing. So I would recommend popping in a couple of times a week, just have a look at the news section, if nothing else, just to see what's happening. It keeps you up to date. We've also got this guide, because this is a very quick whistle-stop tour. So we've got guides on using keyword searches and filtering and collecting things for your favourites and looking at your information pages, that kind of thing. And if it all baffles you, we've got a telephone number that you can ring if you need a bit of help finding what you're looking for or finding your way around the site. Somebody can talk you through Live Well Oxfordshire and how it works. We've got, we can change the size of the text for accessibility purposes. And also, if you know of a service on Live Well Oxfordshire that's just that's not there, that's in Oxfordshire that isn't on Live Well Oxfordshire, you can fill in this really simple, quick form to suggest a service for us, and we'll look into that. And we're really interested in hearing your feedback as well. Did you find what you were looking for? If not, what was it? We can try replicate searches and see if we can weed things out and help you in that regards as well. Finally, I appreciate that not everybody has access to the internet, so we do produce a Live Well Oxfordshire Support and Care Guide, which is a hard copy, and that's published once a year, and that's available for people who've not got access to the internet. Okay, I'm going to hand over to Emma now.
Thank you very much, Lorraine. I've just put all the information about that resource into a chat for all our coaches, because all our service users would really benefit from that database. I didn't know it existed, so I'm really glad to be here and learn myself as well. I'll just share my screen. Sorry. Oh, I'm sorry, I never use Zoom, so I'm just having, there we go. Can you see my slides? Does it say BZ by Maximus Oxfordshire?
Yes.
Perfect. So my name's Emma. I'm the service manager for BZ Oxfordshire. We're commissioned by Oxfordshire County Council to provide free healthy lifestyle courses, weight management courses really, for Oxfordshire. These are 12-week courses, and there's a variety of different, we understand that everybody's different, and so the way in which we provide these healthy lifestyle courses suits everybody. So we have ones for families, which are aimed at supporting children. We have ones for adults. Those can be delivered either online or face-to-face. We have a variety of rolling groups. I think at the moment we have 8 face-to-face groups around Oxfordshire that people can visit for free for 12 weeks. And for the course, they get an hour of discussion and healthy nutrition, and then an hour of free exercise. And the exercise is tailored so that it meets the needs of everybody. So obviously we understand within the group, you may get people that already move quite a lot, or people that are wheelchair, that have limited mobility. So they are tailored to meet everybody's needs. So if you go to an online one, obviously you don't get the exercise. We have groups that are designed specifically for men, and they're only available online currently. They're called Gutless, and they're very, very popular. And the sort of the philosophy of those courses is sustained healthy lifestyle changes. So the information given isn't just around food, it's around stress and how that impacts what you eat. Your mental health, so we touch on that and how that affects how you eat, and so it's very much a learning evidence-based nutrition, and then you applying that to your lifestyle. So there are no meal plans, there are no rules as such. It's just really education and behavioral change support to allow people to make sustained changes to their lifestyle. But then you can also access through BZ Oxfordshire Slimming World or Weight Watchers. Weight Watchers isn't currently on the slide, but both of those people in Oxfordshire, and that's people that either live, work or study, or in fact have a GP surgery in Oxford, can access all these services. So you could have 12 weeks of free Slimming World or Weight Watchers. This is just a bit more detail about the courses that BZ provide ourselves. So as I was saying, there's no quick fixes, no crash diets. It's all about building long-term healthy habits. And the eligibility criteria for all our healthy lifestyle pathways are the same. So as I mentioned, it's live, work, study, or have a registered GP in Oxfordshire, be over 18, have a BMI of over 28, or 23 and a half, people from ethnic minorities who also have a comorbidity. And the programme that we have for children, sadly, we only currently have it online at the moment, because we're just trying to generate some more interest in actually putting on some face-to-face courses for families. But again, they're 12-week courses. The online ones are an hour long, and they include lots of information about nutrition and how to create a sustainable, healthy lifestyle. And the ones that will be face to face, that will hopefully start this summer, will also include an hour of exercise that's really attractive to that child. So it could be something like boxing or tennis or swimming, something that sounds really fun. As I said, Gutless is a program just for men. That's online, and that's always a very sort of lively session. I am mindful of the time, so I'm going to skip out some slides. So the routes to referral for our service are, you can go to your GP and they can refer you. You can refer yourself on our website, or you can give us a call. So it's very easy to refer. The only really exception is that you can only access this service once a year. So there has to be a 12 months gap between the start dates of joining the service, but so you can join, you can come once a year. And this is just a bit of a visual representation of the face-to-face groups that we run. These groups are rolling, so similar to how Slimming World work, these groups don't stop, they just continue every week of the year, but everybody joins for 12 weeks, and this is where they're all currently taking part. If you want any information, please feel free to sign up to our newsletter, or call us or send us an email, and we'd be really happy to hear from you. Many thanks for your time, and I'll now hand over to the next speaker. Thank you.
Is Rachel here? Or
It's Rachel.
Rachel next.
Yeah.
Hello. Yes, I'm
Hi.
here. I'm Rachel, and I'm from Age UK Oxfordshire. And I'm going to speak about the Oxfordshire Advice Partnership. I've just put a link to the new resource that I'm going to talk about today in the chat, and the telephone number for those people who are not able to get online. But we're hopeful that a lot of the people here will be able to make referrals on people's behalf if they need to access the service. So I'm going to have a go at sharing my screen now and hope that it works.
And you need to put it onto slideshow. That gives a bigger view of the slides.
Okay,
Yeah.
I shall attempt to do that. That's sharing, right. Okay, I'm hoping that is in big mode and that you can see that we have had a service. As Kate was saying earlier on her slide, one of the socioeconomic factors is income for people. And the Oxfordshire Specialist Advice Service has been a service that's been supporting people in Oxfordshire, funded by the County Council, to access all the incomes and benefits that they should be getting, and to ensure that they have as minimal debts as possible. And over the last 4 years, these are the partners that have been involved in that service. And we have now grown. We are considerably bigger than we were, and a new partnership has formed. So we now have some of the local advice agencies in Oxford City in particular, so focusing on those areas of deprivation where people have shown larger health impacts. We're really pleased to announce this partnership and maximising people's income. There is telephone and email support. There is face-to-face support. We'll also be running workshops on welfare benefits and other resources in those local areas across Oxfordshire. One of the things that we do have as a resource for people to use is the Oxfordshire Advice Navigator, and that's the link I've just put in the chat there. And this is what it looks like. If you go in, you can look for advice or support. It will give you resources. And if you have difficulty accessing support, so for example, you have an illness or disability, or you care for somebody who does, and you would not be able to action an application for benefits on your own, and you don't have anybody who supports you with that, then there will be a referral form that pops up at the end of the questions that will enable you to refer either yourself or someone you're working with through to the service for in-depth support. That support might be over the telephone, or it might involve a home visit. And it will either be from one of our partners in the service or from Age UK Oxfordshire ourselves. So the focus of the service is to support people who are worried about money and bills and to access the benefits that they're entitled to, but also minimise their debt. And you can see the presentation there is just working through the questions. And then it will ask for permission to make a referral through the secure website to the partnership should people need information and support. And you enter the details of the person that you are referring. So in this case, I referred myself and put in as much detail as you know about that person so that the advisors that we have, trained qualified advisors, can get in touch with that person and have a basic information about what they're looking for, whether there's anything that needs to be dealt with urgently, whether they have very limited income, whether they're looking for a disability benefit, in this case, an example of attendance allowance, and what we can support them with and how. So there's plenty of space for putting in information about the person that you're referring, whether they have any specific financial issues, debts, etc. And then at the end of the information, there is a space for you to put your details as the referrer. And the presentation will move on to that in just a second. And you can put in any other organisation. So if somebody is being supported by one of the colleagues who was speaking here today, or perhaps a social worker, you can put those details in. And of course, the all-important consent to make a referral. And particularly those health details that might be entered on the form. And then that little referral form will wing its way across to the Oxfordshire Advice Partnership triage team, and they will get in touch directly with the client if that's what you've asked for on this form here, or they will get in touch with you using the details that you enter on this page. And they will talk to them about anything that they might be entitled to. They can do a benefits check for them over the phone, or they can organise for that to be done at a visit if they can't access telephone support. And then they will help with the process of making an application right the way through to ensuring that it is paid into the person's bank account. So any benefits, problems, debts or support that you're looking for people you work with, please do share the website. At the bottom of the website, there's also feedback and also there is the telephone number that people can use to get in touch directly. That is in the chat, so it's an Oxford code number to give people a bit of familiarity with the service, and we are able to see people across Oxfordshire. And that's it from me. Thank you.
Thank you very much, Rachel. That was very interesting. I'm going to pass you over now to Adeboy, who's going to talk about National Energy Foundation.
Hello, hi. Like Jazz said, my name is Adeboy, and I work for the National Energy Foundation. So, the National Energy Foundation is a charity that focuses on fuel poverty and keeping people warm and well in their homes. So we do this through delivering our Better Housing, Better Health service. And this is a well-established service that has been supporting residents for over 10 years. Originally focused on Oxfordshire and Buckinghamshire, but now we have expanded over the past couple years to cover numerous counties across England. So the counties that are currently covered in red on the map are the counties that we do. But as we've got our roots as a locally delivered charity, when we started operating in Oxfordshire and Buckinghamshire, we have tried to continue this model of delivery as we've expanded. So this means that we have dedicated teams that cover each counties we work in, meaning we begin to recognize the names of our advisors. We are supporting the residents that you send our way or yourselves as well. So that's a brief summary of us as a charity. So what I'm going to do is just talk to you really quickly about our services. So we have quite a lot of services, and we have made the services as easy as possible to access. So there's many routes to getting in touch with us, including a free helpline, an online referral form, and also an email address. Our free helpline provides residents with a simple point of contact for services, advice, and financial support in order to help improve the energy support, energy efficiency of a resident's home. So we operate Better Housing, Better Health as a case management style service, meaning we'll try to tackle the priority service as soon as possible and then take longer term changes further down the line as well. So I'm going to go on to common interventions. So these are the common interventions we offer at Better Housing, Better Health. So we do general energy advice, so understanding bills, understanding the usage and standing charges. We also advise on switching tariffs or suppliers as well. And if a resident or customer is not happy with the customer service from a supplier and want to know what their options are and how we can help with this, we'll be able to help them, give them the options they have, like the ombudsman email and everything they need to do, and how to make complaints as well. We also add residents to the priority service register. So the priority service register is a register that anyone that is vulnerable can register to it, and then there'll be quite a lot of things that happens in the background. So like, say for instance, if there's a power cut, they'll be able to help you with that, give you a generator, or if you have if you have medicines that belong in a fridge, they'll be able to give you a generator to keep it going, so you don't lose that energy in your property. And then I'll talk to you about so we also have energy advice, energy depth advice and local support services. So we'll be able to refer to other local supports around your area as well. And then I'll go on to emergency fuel vouchers. So our emergency fuel voucher, we are currently running a scheme, and it's £49 fuel vouchers. Have you guys heard? I believe you guys know about fuel vouchers. So these are prepayment fuel vouchers where they can take the code up to the shop and they can top it up on their prepayment meter. So we give quite a lot of this. We give about 6 per household, and it really helps. So that's about £300 worth of funding to a resident's energy bills. And our emergency fuel vouchers are one of our services that we can offer with no eligibility criteria, meaning that any households can receive the support with no income threshold or mean tested benefits required as well. But the only caveat being that the household has to pay for the energy bills via prepayment meter. And then I'll go on to our free home energy visits. So we offer quite a lot of our services through the phone, but with our home visits, we can come to your property and offer the services to you in person. I'm not going to go into too much depth in that, but yeah, anything that we can do over the phone, we'll be able to do in person, and then we can give small measures to you as well, just to make you feel a bit more comfortable in your property, like not emergency fuel vouchers, but blankets, like LED light bulbs as well, things that can make you just feel more at home and save that bit of energy as well. And then I will talk about the grants that are going on at the moment. So we have the eco funding grant as well. So that's to replace boiler or to get insulation in your property as well. And then we have the national grid grant as well. So that's with, like, if you're not eligible for any of our services any of our larger services, we'll be able to put you on that national grid grant, and it's just more of a lenient eligibility criteria, just to give that help to people that really need it as well. So I do have a video of a case study that we worked on, and I do think it's a very good video, so I would like for you guys to see it as well.
My name is Heather Jeffs, and I have lived here at Pavenham in a mobile home for the last 43 years. I'm now 80 years old, been retired for a number of years, and now mainly I spend my time doing the gardening and walking the dog. And unfortunately, I lost my partner 3 months ago. I've noticed over the years that we've lived here that it has appeared to get decidedly colder, but of course really it was a case of we were getting older. It wasn't perhaps the weather changing, it was us. We did get the funding. Everything was going through fine. Michaela, as I say, really put herself out. She was great. But then, unfortunately, my partner died. The work that we had done, it was absolutely brilliant. We are so pleased with it. Well, I keep using we, but of course it's I am very, very pleased with it. Before, it was knowing that he was all right, that my husband would be warm enough to get through the winter and so on. He's no longer here, but I now have the peace of mind that my home is sound, it is warm, and that I will get through the winter without the enormous bills, hopefully. I feel much happier, much more content that I'm not going to get big bills and that I will be warm in the winter, and that is peace of mind, and that at my age is lovely. That's all I'm asking for, really. He would have loved it, he really would. This was it was all, you know, a couple of weeks from it starting and he died. So, but the idea was it was for him, yeah.
Yeah, so no matter how many times I see that video, it still gets to me because it just shows how the work that we do. It just affects a lot of people.
Heather Jeffs.
But yeah, so then how to contact us. So this is our contact page. So there's quite a lot of ways you can give us a call or get in contact with us. So we have a website, we have a phone number, and we have an email, or you can get in touch with us through our socials. We also know that you work on the tight time constraints, so please don't worry about trying to find if someone's eligible for help before referring them. We can do that for you, and we're also able to give you feedback on how we've managed to help the residents you send our way or yourselves. So if you do have any ideas on how we can work together to support your services as well, it would be great to hear from you, and please do get in touch as well. And then I'll show you our referral page on how to make a referral towards us. That's it. And so yeah, so pretty much all you need to do is just put in the name of the resident, and their phone number, and possibly the postcode, so we know where they're getting referred from. But you don't really need to put in anything else. It will just automatically go to us. It is good for you to put in your details as well, so we know that you are referring them to us, and then it kind of eliminates the extra security we do, so we know that they are who they say they are. But yeah, thank you for listening. I hope you found this very useful. If you have any questions, I can take them now.
Thank you, Adeboye. I'd like to pass you over to Imogen now from Oxfordshire County Council, who will talk about alcohol harm prevention and the drink coach too. Imogen, you've got about 5-6 minutes, because I'm conscious of the time. Thank you.
Thanks. Can I just check you can see my slides?
Yes, thank you.
Lovely, thanks. And thanks, Adeboye. That was really interesting. And wow, what a powerful video. Brilliant, thank you. So hi everybody, it's great to be here today. My name's Imogen Coningsby. I'm based in the drug and alcohol team within public health at Oxfordshire County Council. And today I'm really pleased to be here talking to you about the Drink Coach test and online coaching, which are tools that are available to Oxfordshire residents to support them to reduce their drinking. And the purpose of today is really just about raising awareness of these fantastic sort of resources that are available to you, and to politely ask for your help in spreading the word. So without further ado, I will. Oh, I said I'd change slide. It's now not changing. Hopefully, maybe it's just something that happened to Kate earlier. I'll hopefully it will suddenly jump forward. Sorry, bear with me a moment. Okay, here we go. Sorry about that. So I'm going to talk about the online coaching first. So this is a new service that Public Health have been commissioning as of the 1st of March this year. And it's aimed at Oxfordshire residents who are 18 and over, who score what we call at increasing risk or higher risk on the Drink Coach test. So what the hell does that mean? That means basically when we say someone is drinking at increasing or higher risk levels, we say that that is so drinking more than the NHS guidance of up to 14 units a week. So it's covering somebody basically that's drinking 14 units a week, right up to that sort of level of alcohol dependence. So the coaching is available for anyone that sort of sits in between those two continuums. And people can have up to 6 40-minute sessions with a Drink coach, and the coach will basically help the person to set some goals in relation to their drinking, and then they will support that person to achieve those goals. So a bit more about the Drink Coach test. So this is available to anybody. It can be accessed online via the Drink Coach website, and it's a really quick and confidential way to assess basically your drinking habits. So it asks you 10 questions about your drinking behaviour, and then based on your answers, it can provide really personalised feedback on how risky your drinking might be, and it can offer some information and advice on how you can manage your drinking, and it suggests some follow-up actions as well if required. So the test is designed to be really quick. You can complete it in about 2 minutes. It doesn't collect any personally identifiable information. So the reason I mentioned the test really is if you're not sure if you're eligible for the Drink Coach coaching, then you can simply find out by taking the Drink Coach test. And if you are eligible, then it will signpost you to the coaching. So the coaching is completely confidential. I think its real sort of perk is that it's offered 7 days a week, including evenings. So this is, making it a really accessible option for people. Obviously, it's online, so there's no travel time, and it's really convenient. And it can be the coaching sessions can be booked directly from the Drink Coach website, or like I mentioned, it's signposted at the end of the Drink Coach test, and I'll give you a little demo of that in a moment. Now, some of you might have heard of Turning Point. So Turning Point is our main sort of drug and alcohol service within Oxfordshire, and you might be wondering where this coaching sits with the services they provide. So just to be clear on the sort of distinction, I suppose, the online coaching that's provided by Drink Coach is aimed at people who are drinking at increasing or higher risk levels, which I explained on the previous slide. In contrast, Turning Point generally tend to see people drinking at very high risk levels, or they might be experiencing alcohol dependence. So if someone is drinking at those very high risk levels, or they are possibly experiencing dependence, then that person should access Turning Point as opposed to the as opposed to the online coaching. The online coaching is sort of primarily that lower level of support. But yeah, if it's not clear which service you should be going to, just complete the drink coach test, and that will tell you. And just to show you sort of some of the imagery that we've produced to raise awareness of this drink coach coaching. So this is an image that's been used on Facebook and Instagram, and our sort of posters and leaflets that have been going out across the county. So I just wanted to show you what that looks like, so that you can look out for it. And now I'm just very quickly going to show you a demo of what the website looks like. Hopefully this will work. So can everybody see that? I will take silence as a yes, but please interrupt me if not. So this is the Drink Coach website. And to access the test, you just go up here to alcohol test, click take the test. It will then take you to the test, and then you can simply complete it. So I live in Oxfordshire, I'm female, next, and then it will start to ask you questions about your alcohol intake. So really quick, really simple. I won't go through all the test, but just to show you how to access the coaching as well. So very similarly, there's a tab up here that says online coaching. You can go to about online coaching and it will tell you all about the offer. You can simply click book appointment. And then, oh, it has opened another tab. Let me go to here. So book appointment. Book now, and then these are all the other areas that provide free online coaching. If you go down to I live in Oxfordshire, book now, and then it will load this booking page, and it's really simple. These are the dates, times available, who the coach is with. So yeah, you could literally book an appointment for tomorrow. It's as simple as that. And that concludes my presentation.
Thank you, Imogen. It's very interesting. I'd just like to say thank you to all of our speakers. Amazing presentations, and there's so much good work happening in Oxfordshire that's, you know, to help people and make a difference in their lives. So thank you, everybody. I'd just like to open the floor now if you've got any questions. No questions?
Education was one of the things you mentioned as having an effect on people's health. What is being done about that for people who are not at school, for instance?
Shall I pick that one up, Jazz? That's a really good question. So we have a whole team in the county council that can support families with that. So Jane, if you'd like me to share some contact details with you, I can do to pass on more information about that.
I don't mean children who are not at school. I mean, what is being done for adults?
For
who
adults,
may be sat on their education, where it's important, you consider it to be important for prevention.
That's right. Yeah. So we don't directly commission any education programs in public health. There are various partners within the system in the county that we work with. So there are various colleges around the county that offer adult education courses, if it's that sort of thing, or core key skills as well. So we would probably signpost people onto those providers to be able to provide that support.
Okay, thank you.
Thank you. Any more questions?
I've got a question about the LiveWell website, and Kate, maybe you can just answer. So you'd encourage groups that are doing different activities to add to this. I noticed there's a patient participation group doing a day on care for the elderly. Would that be something where they could add their event onto that?
Yeah, we would really welcome that. So we're trying to make the website a real go-to place that everyone can put their information onto, so that people have just a one-stop shop to be able to look up anything related to health and well-being and the wider determinants there. So we'd really encourage groups and organisations to do that and put their information on. If they have a regular service that doesn't necessarily have particular dates and times, then that can go on in the general search function. But if they have particular events like the one mentioned in the chat, then that can go onto the calendar page. It's really easy to sign up. So there's a link on the website that takes you to sign up. So if they sign up as an organisation rather than as a member of the public, then they'll be able to input all their details and people will be able to search for their activities. So we'd really welcome that.
Thank you, Kate. It's Neville Varnum speaking. I'm a member of the patient participation group in Soin Common, the health centre. So we are planning an evening event, and we're thinking about doing everything we can to make sure people come along to it. So advertising it on that site as a specific event at a specific time would be very, very useful. Thank you.
Brilliant. Thanks, Neville.
And just to note, for those who are in patient participation groups, I've added a thing in the chat because the Integrated Care Board has also set up a website page specifically for Oxfordshire patient participation groups. If you sign up to that, you can also share information across the patient groups in Oxfordshire. So I'd really encourage that. The link is in the chat there.
Yes, I've got that. Thank you very much for that. Much appreciated.
What was the link, did you say, for the participation groups, please?
Yes, so it's on the chat in this webinar. Otherwise,
I can't do it. I've only got an iPad.
Yes.
Anyway, Jazz knows us.
Jazz knows you, and Jazz can share it.
Hopefully she can. You can share the link. That would be lovely, Jazz. Thank you.
I'll do that.
Thank you so much. We've got a meeting on Friday. Thank you.
Okay, I'll send it to Sue. All right. Then.
Thank you.
Thank you. Any more questions?
I've got another question, if that's okay. Kate, I know that you do making every contact count training, which is perhaps you'd just like to explain that, because it'd be really useful for some of these groups here.
Yeah, thanks, Veronica. And when we were thinking about what to include on the agenda today, I think we could have filled up a whole day, couldn't we, of different activities and services to talk about. So yeah, so Making Every Contact Count is a training program that can help to give people the skills and confidence that they need to have conversations with others about health and well-being. So we have various different forms of training available. There's an online e-learning that we can share the link to in the chat. So that takes about an hour, and people can go online and pick up the key skills about how to have conversations with other people about health and well-being. And then actually we encourage people to signpost on to the Live Well Oxfordshire website if in the conversation it comes up that someone might be interested in a particular activity or might benefit from having a chat to someone in a different service, then we would signpost there. We also do a longer training session, and really we encourage people to do that slightly longer one, because they're usually online but in a Teams call or a Zoom call or something like that, so that there's some interaction. It's not just straightforward online learning through a platform, and then people can actually practice their conversation skills as well. And we've worked with a number of different organisations around the county to encourage people to do that. So it's really a beneficial skill for anyone, whether it's for having conversations with friends, family, perhaps through your work with colleagues, or people who might access a service where you work as well.
Thank you, Kate. We'll also promote the website on our. We send out emails to our PPGs, so that link is cascaded to as many people as possible of what's available in Oxfordshire. Okay, thank you. Any more questions before I call it a close? Thank you, everybody, very much, especially to our speakers, were amazing, and to everybody who's participated today. And I look forward to seeing you on our next webinar. Thank you very much.
And just to add, our next webinar is on the 10th of June at the same time. And the topic this time is Let's Talk About Menopause. And that's leading on from the piece of work we did on hearing from women about their health. So we do hope you'd be interested in that one.
Thank you.
So
Thank you.
Thank you very much, everybody.
Thank you very much, everyone.
Bye.
Bye.
Take care. Bye.